Good afternoon, everybody. Aaron Hackett here again with awittypt.com. I need to give you a warning. I'm going to use a four-letter word today. So just watch out. You might all be surprised at what it is. If you got kids that are listening, turn down that volume or watch a little bit later. Just giving you a warning. So I was presented with a question by a fellow physical therapist, Anthony Meritato. He loves to ask me questions, and I love to respond to his questions. And he's the one that used the four-letter word too. So I wanted to give it as much consideration as I could. And so I actually wanted to go to a place to where I could just really think about a good response for him. I wanted to make sure it was a quality response. So welcome. I'm at where a man can think best. Welcome to my bathroom. And yeah, keep your eyes on the prize. Don't go below. You'll be too, might be sorry. So you ready for the four-letter word? That's right. He was questioning the utility of pain, regardless of function, for things such as just prognosis of a patient, plan of care, but then also determining the further need or medical need of that skilled care. And so me doing clinical review and clinical utilization management, he wanted to know what my opinion of this was, because what he has seen quite a bit, and looking back at some of his own old notes, is a lot of goals that were only focused on pain, percentage of pain, and trying to adjust that pain level one way or the other. So here are my thoughts. Number one, this is going to be primarily determined by the health plan or whoever is paying for the care. If it's cash-based and that patient is paying all of it for themselves up front or however, and pain is their only goal, that's for them to decide along with their provider. And I'm not really going to get into that a whole lot because that wasn't the premise of his whole question. Number two, yeah, potty jokes, gotta love it. Second part of my response is now, as far as the health plan is concerned, it's going to determine. Part of it is going to be determined by how they determine their clinical guidelines that they utilize to determine medical necessity. The majority of health plans that I'm aware of, and especially the ones that I do reviewing for, pain by itself is not enough to determine medical need of care, at least as far as getting treatment in skilled rehabilitation, physical therapy, occupational therapy, and so forth. For the most part, you could probably get away with some visits to start care, to set up a home program so that that patient can then learn to modulate their own pain. And up to that point, the clinical guideline would indicate that if they're just being seen for pain, that's not enough. Most health plans are now, what they're wanting to see is they're wanting to see an improvement in function. And this is exactly what you were talking about, Anthony. You need to tie that pain to some kind of function. If they have a whole lot of pain, but they can do all their daily activities, maybe just that home program is enough. Why do you need to keep seeing them? Are they doing things that are making it so that they continue to be painful? There are some people that they will just continue to work. They will continue to push. They will put aside recommendations from medical community, and they will continue to live in pain. So does that mean they should continue to get care because they continue to have pain? I don't think so. So health plans are starting to, they're starting to want more from the care that they are paying for as far as the ways in which they see a patient progress. So yes, Anthony, like you said, there needs to be some kind of a function or an improvement in a disability that is tied to those pain and that needs to be established through the goals that you're writing. So just having goals for reducing pain, like patient starts at 8 out of 10, and goal is to have pain of 2 out of 10 within 6 to 8 weeks. That's just not enough anymore. We can do better than that. We're being taught to do better than that in school. And one other really big reason for this is that what's considered usual and reasonable and usual or reasonable and necessary care that is established by our peers, by those that research and the people that we call the experts. So things like JOSPT, AOS or AOPT, some of the international groups, the orthopedic groups and physical therapy groups, they are creating peer-reviewed and researched clinical practice guidelines. And that's where a lot of the health plans are going to create their guidelines from, is utilizing that published information to create guidelines. So, and in those guidelines, the kind of golden standard recommendations for tracking care are functional outcomes and then functional measures, and not just range of motion and strength. So, you got your outcome scores, obviously, like your OSWESTRI disabilities and your DASH and lower extremity function scale and LEFI, those things, but then also things like Berg and Tonetti, 6-minute walk test, 5 times sit to stand, single leg stance, all of those things. Now, of course, you could tie a pain to that. You could say that you want them to have a certain DASH score within a certain amount of time and a reduction in pain. It's, there's nothing wrong with helping someone reduce the pain, and I'm certainly not saying that. But we are now marketing ourselves as people that improve function and improve movement. Our peers are recommending this to us as the way to treat. And this is what most health plans are also now wanting to reimburse a provider for, is care of that nature. So Anthony, I hope that helps a little bit. And I hope this helps others. If you have questions, comments, I may not have done that complete justice. Sometimes it's a complex situation. So let's make those goals functional, people. Even if we are working on pain, find out how that pain is disabling the patient, and then use that as well. That's all I've got for you. I love to answer questions like this. So again, if anyone else has questions, find me on social media, post a question to me, tag me to that question, however you want to do it, and I will do whatever I can to answer that question. All right? Well, I think I'm done in here.